Welcome to This Explainer. Today, we're diving into a massive global health condition that operates almost entirely in the shadows: chronic kidney disease, or CKD. Because this progressive condition develops over months or sometimes even years, it's really an invisible threat. But as we're going to see today, understanding exactly how it works is absolutely the first step in disarming it. Okay, let's look at the sheer scale of this issue: 10%. Think about that for a second. That's a staggering number. Chronic kidney disease affects roughly 10% of the entire world's population. It is literally one of the leading causes of illness and death globally. And here's the thing, it can affect anyone at any age, though it definitely becomes a lot more common as we get past 60 or if we have other underlying health conditions. We're talking about hundreds of millions of people whose bodies are quietly struggling just to maintain their internal balance. To truly understand what's going on, here's our clinical roadmap for today. First, we'll look at the body's master filters, then the silent breakdown, spotting the warning signs, diagnosis and medical defense, dialysis and transplantation, and finally, taking back control. All right, part 1, the body's master filters. Your kidneys are absolute marvels of biological engineering, and the whole operation, it comes down to this microscopic structure right here, the nephron. Get this, you actually have about 1 million of these tiny filtration plants inside each of your kidneys, just working away 24/7. And they don't just produce urine. Actually, scratch that. They're really your body's ultimate regulatory system. They're maintaining your acid-base balance, they're activating vitamin D for your bones, producing a hormone called erythropoietin, which basically tells your body to make red blood cells, and they even regulate your blood pressure. Every single drop of your blood is constantly being screened, cleaned, and perfectly balanced by these incredible little microscopic units. Section 2, the silent breakdown. So what happens when that incredible microscopic system gets compromised? Well, we see this progressive domino effect. It starts with step 1, an initial kidney injury that damages some of those nephrons. Now, your body is incredibly resilient, right? So in step 2 and 3, the remaining healthy nephrons actually try to compensate by working way harder. It's a process called hyperfiltration. But honestly, they aren't meant to carry that kind of load forever. Over time, all this overworking leads to step 4, which is progressive scarring or fibrosis. As more and more nephrons scar and eventually die off, we hit step 5. Your glomerular filtration rate, or GFR, drops. Basically, your overall filtering capacity plummets, and that allows dangerous waste products, known as uremia, to just build up in the blood. So what actually triggers that initial damage in the first place? Well, the primary drivers of this microscopic destruction are actually remarkably common systemic issues. Diabetes mellitus is the #1 culprit worldwide, followed really closely by hypertension or high blood pressure. These conditions place just an immense amount of stress on those delicate blood vessels inside the nephrons. But looking at the additional risks, factors like chronic use of certain over-the-counter painkillers like NSAIDs, obesity, smoking, and even your family history, they all play major roles too. The absolutely crucial takeaway here, though, a lot of these risk factors are things we can monitor, manage, and in some cases prevent entirely. Moving into section 3, spotting the warning signs. Which brings us to a really vital question. How do we even know if this microscopic damage is happening? Well, medical professionals track the damage using a very specific metric, the estimated glomerular filtration rate, or eGFR. Think of it kind of like the percentage of your kidney function that is still online. In stage 1, the eGFR is actually totally normal or even high, but there's clinical evidence of physical kidney damage. As the disease progresses through stages 2, 3, and 4, you can see that eGFR dropping, signifying mild, then moderate, and then severe loss of function. And finally, stage 5, that's end-stage kidney disease or kidney failure, which means the filters have almost entirely stopped working. Now, I need you to notice this first point because it is absolutely crucial. The early stages are completely silent. You could literally be in stage 1, 2, or even 3 and feel absolutely fine. No symptoms at all. It's only as the disease significantly advances that you really start to feel it. Because waste and fluid are just building up, patients experience severe fatigue, loss of appetite, and swelling, especially down in the feet, the ankles, and around the eyes. You might even see foamy urine, which is actually a sign of protein leaking right through those damaged filters. Or you might find yourself waking up constantly at night to go to the bathroom. And as things get more severe, that's when shortness of breath, terrible itching, and dangerously high blood pressure can kick in. Section 4, diagnosis and medical defense. Because those early stages are totally silent, our medical defense is absolutely vital. We have to build a protective wall around whatever kidney function is left, and that defense starts with some simple tests. A basic blood test to check serum creatinine gives us that super important eGFR number. But even earlier than that, a urinalysis checking the albumin to creatinine ratio, or ACR, can detect tiny microscopic amounts of protein leaking into the urine. That's literally the very first sign of structural damage. Once it's diagnosed, the medical strategy is aggressive protection. Doctors will focus on strict blood pressure and blood sugar control. They use specific medications like ACE inhibitors or ARBs, and there's this newer class of drugs called SGLT2 inhibitors. These are a real game changer because they've actually been shown to physically slow down the progression of the disease and protect cardiovascular health. It's a highly individualized, multi-front defense. Part 5. Dialysis and transplantation. However, if the disease progresses untreated or if it's just particularly aggressive, a patient might reach stage 5. When the nephrons can no longer sustain life, we literally have to replace their mechanical function. And there are two primary ways to do this. First up, we have hemodialysis. This is where a patient's blood is physically pumped out of their body, run through an external artificial kidney machine to remove all that waste and excess fluid, and then safely return to the body. Then there's peritoneal dialysis. This one is fascinating. A special fluid is introduced right into the patient's abdomen, and the actual inside lining of their own abdomen acts as a natural blood filter. Both of these are incredible, life-saving procedures, though of course they do require some massive lifestyle adjustments. But for eligible patients, the absolute best long-term outcome is a kidney transplant. This is a major surgical procedure where a healthy kidney from either a living or deceased donor is placed into the patient. A successful transplant doesn't just filter the blood, it actually replaces all the complex functions of those lost nephrons, the hormone production, the blood pressure regulation, the whole shebang. Now, yes, it does require the patient to take immunosuppressive medications for the rest of their life so their body doesn't reject the new organ, but it offers a dramatic improvement in survival and quality of life, completely freeing them from the dialysis machine.
Finally, Section 6, Taking Back Control.
Look, whether you have early-stage CKD or you're on dialysis, or honestly, if you're just looking to protect your kidneys right now, there is so much power in your daily choices. Managing this isn't just about taking medications in a hospital room, it's about what you do at home. Physiotherapy plays a massive role here. Guided walk programs, aerobic exercise, and resistance training, these all help improve cardiovascular fitness, reduce fatigue, and keep your muscles strong. And then there's nutrition. But let me be clear, this is not a one-size-fits-all diet. Renal dietitians work with patients to create highly individualized plans. Depending on the exact stage of the disease, that might mean carefully managing your protein intake, drastically lowering your sodium, and specifically monitoring potassium and phosphorus levels so they don't build up in your blood. Oh, and quitting smoking and staying properly hydrated, those are absolute non-negotiables if you want to protect those delicate little nephrons. I really want to highlight this quote directly from the clinical guidelines because it's so essential. Early treatment improves survival and quality of life. Many patients live for years without needing dialysis when CKD is managed appropriately. That is huge. A diagnosis of chronic kidney disease is not a hopeless sentence. It's a call to action. When we catch it early through just a simple blood or urine test, and we manage it with the right medical and lifestyle interventions, we can actively put the brakes on it and slow that progression way down.
Which leaves us with this final thought. Right now, inside of you, roughly 2 million microscopic nephrons are working silently 24/7. They're filtering your blood, they're balancing your fluids, and they're literally keeping you alive. They do all of this for you without ever asking for a break. So with your body's master filters working this incredibly hard, what will you do today to protect them? Thank you so much for joining me on this explainer. Stay curious, stay proactive, and take care of your health.